A warm wishes to all. I'm Jayprabha. I'm going to present early prediction of chronic kidney disease using big data analytics. A CKD, that is chronic kidney disease, is the major issue in our healthcare sector. So CKD is the significant contributor to the death of most of the people in the world. Nearly 14% of the world population is affected by the CKD. So, early prediction of the CKD is the best way to prevent from the major losses such as heart failures, brain damages, liver damage, sometimes premature mortality. The CKD affects the 20% of the population over the current world. So, major drawback is we can't predict it easily. So the big data technologies and some analytic technologies has revolutionized the healthcare landscape is offering unprecedented opportunities to enhance our understanding of the CKD, to improve the patient's outcome and the streamlining of the healthcare process to prevent the CKD mortality. So what is CKD? The CKD is a gradual loss of kidney function over a period of time, so it affects the 10 to 20 percentage of the global population. It can lead to the end stage renal disease, which is requiring a dialysis or the kidney transplant. So kidney disease CKD. So it is a disease which is progressive loss in kidney function over a period of month or the year. So nearly 26 million American adults have chronic kidney disease, which adds up to about 1 in 10 people. So the major cause for the CKD is the diabetics as well as the high blood pressure. So these two main causes are it produces the CKD in our body and without our knowledge. And the major risk factors are the diabetes, high blood pressure, family history, overweight, smoking, over 50 years old, and most of the Asian regions. These peoples are affected by the CKD very easily. So in the CKD we have too many stages. In that major four stages are the first one, kidney damage with normal kidney function. So our kidney will be working but the kidney started to damage, and the kidney damage with mild loss of kidney functions, which may me like we can't urinate properly or else a continuous fatigue, such kind of problems we can predict. And the third A stage, mild to moderate loss of kidney function. The third B stage is moderate to severe loss of kidney function. So at this stage only most of the people are being identified that they have the CKD. And the fourth stage is the severe loss of kidney function. So almost the kidney has been stopped to working, but due to some help of the aid, it will be working. And finally, the major kidney failure, which may the kidney will stop working permanently, and we need the support system to run our kidney functions. Of the protein level of the kidney, blood attributes, and other abnormalities in our body. And the imaging of the kidney images used is identified by the ultrasound, CT scan, or the MRI to visualize the kidneys. And the proper treatment for this CKD is the lifestyle change. So the proper diet, the regular exercise, and managing the stress level is the major thing to protect from the CKD. And the medications are based on the controlling the blood pressure, blood sugar, and the cholesterol level. So the major prevention methods are maintaining the healthy lifestyle, monitoring the blood pressure, and get tested regular basis. So why we include the big data here? So because of the big data and its characteristics, so we can easily analyze the large set of the patient's data set. So if you compare the data set, it is very huge because almost 20% of the population having the various kind of kidney diseases. So all the data set are easily managed by the big data. And it identifies the complex patterns and the correlations between the different kind of attributes which will cause the CKD, and it enables the early detection and the prevention. It improves the patient's outcome through the personalized medicine, and it enhances the decision making for the healthcare providers since the CKD has been identified at the early stage. And the major uh, uh, because of the help of big data, we can easily identify the kidney problems, and we can easily categorize the kidney images, and we can scan the images for the kidney, and we can apply the deep learning methods to identify the kidney problems based on the algorithms, and we can apply the image pre-processing techniques, and we are identifying the kidney disease, and finally we can report the kidney disease. At the last stage we can find in which stage the particular person is. So the key techniques here, we are going to follow the deep learning method in big data. So the feature extraction for the kidney disease and classifying which kind of kidney disease the person is having, and the temporal prediction with the previous data, and the sequential modeling to identify the stage. So in this proposed system, the person's detail from the data set, we are going with the attribute selection. So based on the urine test and the blood test results, the attribute will be selected, and the selected data will be pre-processed, and the classification techniques will be applied, and the early signs were predicted. Based on that, we can predict the CKD and the non-CKD. The next stage, we can identify the accuracy level of the prediction, and finally we can predict the person in which stage the person. So in this proposed system, in the pre-processing, we have to go through the data cleaning process. So the unwanted data will be removed, and normalizing techniques will be used to identify the patterns, and the categorical feature